Great. Okay, welcome everybody. Thank you so much for joining me today. My name is Dr. Garcia Webb. I am a board certified physician in internal medicine, lifestyle medicine, and obesity medicine, and I have a private practice in Massachusetts. You can work with me if you want. I will leave that information on the sidebar. But today we're going to answer questions that you have sent me in terms of weight medicine. So let's get started. Some great questions here. All right, so let's see. First question. This one was a great question. It was very long. Oops. Okay. Mike is back in action. Okay, let's see. Okay, so first question was, yeah, this is a little bit of a long question, but a very good question. All right. So this was about medications that are prescribed off-label for binge eating if there are other eating disorders present. Okay. So I think this is about topiramate. Does this ever get prescribed for binge eating and restricting cycle in long-term eating disorder adults never deemed to technically meet either anorexia or bulimia criteria when they were diagnosed, but have always fluctuated between low healthy and slightly underweight? Okay. Until any research is done on all the chronically fluctuating borderline underweight, balanced binge eating people and people who restrict, what treatment seems least theoretically to make sense or to appeal or petition for anorexia style or binge eating style treatment? Okay, I think what this question is getting at, and comment afterwards if you have follow-up and you posted the question, but I think what this question is getting at for is off-label use of weight medications for binge eating. Now, I will say as a caveat, we do have medications that are FDA approved for binge eating, such as Vyvanse, but I have noticed, I'm sure many other physicians have noticed that what's really helpful for the weight medications, especially the GLP-1 agonists, is that they do seem to decrease that food noise and the cravings, and they can really help with binge eating for some patients. So, but they're not currently approved for treatment of binge eating disorder. I think if there are other eating disorders present, such as anorexia or bulimia, and somebody is in a normal BMI, it's really a case-by-case situation, but I would be extremely hesitant to use it. And I think it also depends on, what the predominant issue is. If the predominant issue is somebody is binge eating and then they are restricting afterwards versus, that's a little bit different than somebody who is doing more of a cyclical restricting and binging cycle. So I think it's very patient dependent. If someone has a normal BMI but really struggles with binge eating, and that's the primary issue, it's somebody I would certainly, and of course these are all, theoretical. I'm not answering anybody's personal medical questions here, but that's certainly somebody I would consider. But if there's other eating disorders, gosh, it's really case by case. You have to be so careful because you want to make sure that you are, first do no harm. So I guess that's my answer for that. I can't say for certain, but I do think there is a role down the road for binge eating disorder. It's just not covered right now. So I could prescribe it. I just need that patient to know that it's just not going to be covered. And then that's their choice if they want to spend their own money on it. But yes, case by case, exercise caution, first do no harm. Next question is, how to begin lifting weights? How much should you start with? I think, this is a great question. Weight training is so important If you are just doing lifestyle changes, if you are doing lifestyle changes and also incorporating medication, anytime you lose weight, part of that, a percentage of that is going to be muscle. So regardless of the method, gastric bypass, healthy eating, medication, all of the above, you always want to make sure that you're really adding strength training in to offset the inevitable muscle loss that comes with weight loss. And so, technically, the recommendations are for, 30 minutes twice a week for strength training. And it really depends on where the person is in terms of their knowledge of strength training. So if you've never ever lifted weights before, that's somebody that I will always recommend does a visit with a trainer once or twice. You don't have to see a trainer once a week forever. I mean, you can if you want. Always a great, resource, but you don't have to. But I definitely would set up a one-on-one meeting with the trainer just once or twice so they can show you the correct form. You really don't want to get injured. And also it's good to be able to, know how hard you should be pushing yourself, how many reps, how many sets. What does that feel like when you're pushing yourself but not in an unhealthy way? I think that's something that meeting with the trainer is going to be really helpful for. And also, people tell me they're lifting weights and they're lifting these like 1 pound, dumbbells. And I'm like, it's a good place to start, but it's not going to get you the results that you want. So that would not qualify. That would be kind of like a run up to weightlifting, but I want people to progress past that, of course. So find a trainer once or twice and then go from there. Next question. How do you lose weight with gain from an SSRI? Well, that is tricky. I have patients that definitely gain weight on an SSRI. And, one of the questions, if they do gain weight, is, what is this medication helping? If it's not helping, obviously that's a different discussion. But if it is helping and they want to continue it, then the first step is really to make sure that everything is optimized in terms of lifestyle changes. So are people eating the way they want? Are they exercising the way they want? And if they're not, how do we fix that? But sometimes with the SSRIs, sometimes the weight comes right off. Sometimes it doesn't. I don't think there's a way to predict this. Unless there, are other medications that would really be fighting with weight loss as well. But I definitely have some patients that the weight does not come off, even though they've been off the medication and they're making all the lifestyle changes. So if that is the case, that's a great point to add a weight loss medication. And what that is certainly going to depend on the person, what their mental health history is like. Certainly we're finding more and more case reports or anecdotal times in clinic where people are, mental health, while in general gets better with these medications, for that one person every so often it gets worse. And so again, very much a case by case situation. But if somebody has, mild mental health issues and they want to try something like a GLP-1 agonist, if they're not losing the weight, and their lifestyle changes are really optimized, I think that's a great option to have, because sometimes it can be very difficult otherwise. Again, really depends on the person. Okay, so next question. How do you lose lower abdominal fat? I would say the same way you lose any other fat. There's 3 ways that we lose weight. There's lifestyle changes, there's medications, and there's surgery. And so I don't think we're talking about surgery in this case, but how do you lose lower abdominal fat? The same way that you lose any other fat. And we can't really spot reduce fat loss. And certain people's bodies are going to, gain weight and lose weight in various areas faster than others. That's really genetics. And it's also hormonal. Certainly for women in the perimenopause, menopause, postmenopause, there is more body fat storage around the abdomen, which can be very jarring for women and new. And so that is likely going to be more difficult. It's probably one of the last places that someone might lose weight in that situation. But I would just focus on the lifestyle changes first and then medication as needed. And then also take into account, your own weight history, your body best, and then also the stage of life that you're into. Next question. Okay. What do you say? Oh, okay. It's the theme of the day is weights here. Okay. What do you say to people who are worried about bulking up due to weight training? I get this question. I mean, this is, I think, a common question for women who are not used to working out with weights. And I really wouldn't worry about it. I mean, the more muscle you have, the more you are increasing your resting metabolic rate. And so that's one of the only ways we can control our resting metabolic rate. You can't control how much energy your liver burns, but you can to some extent control how much muscle you have. And so I think I wouldn't worry about bulking up. I mean, I think that's if you're using a lot of like supplements, or if you're certainly there are ways to like go down the bodybuilding route, but if you're not actively going down that path, I really wouldn't worry about it. I think it's really good for you, and I think you're going to be the size that you're going to be, and you're going to be healthier when you're lifting more weights. So I wouldn't worry about it. I would focus on getting stronger. I would focus on increasing your lean body mass, your bone strength, your flexibility. Those are all really good things to focus on. And you're going to be happier the healthier your body is. So that's what I would focus on. And and if you've never tried it before, again, definitely follow up with the trainer first. And go from there. Okay, so these are the questions today. Thanks so much for the great questions. If you have more questions afterwards, just leave them in the comments, or you can go over to my YouTube page and put them in there. And thanks so much, and please be well.